I was born with a bicuspid aorta, so my valve area has always been smaller than it should be. I've always had it, I've always known I had it. My parents, starting at a very young age, educated me about it. And I kind of went through life getting checked every year. In 2008, we found out we were having triplets, and I skipped a year or two. And when I came back 2 years later, I found out that my valve had hit a point. It had been narrowing over time, and it had hit a point that we needed to do something about it.
He was sent to me for consideration for valve replacement. The options typically consist of a tissue valve, which is made either of a pig aortic valve or cow tissue, which is made into an aortic valve, which is what we use here at the Medical University, versus a mechanical valve, which is it's a two-leaflet, it's a two-part valve that opens and closes. It's made out of pyrolytic carbon. They both have their advantages and disadvantages. So this is a very critical discussion that we had with Mr. Byrne because this choice is important.
And due to my age and health, we went with the mechanical valve because it's something that is permanent. It lasts for a very long time.
The data that we have on aortic stenosis shows that from the time of diagnosis and development of symptoms, which he had, if those symptoms are heart failure, 50% of those patients actually are dead within 2 years. And so replacement with a device, either an artificial or mechanical valve, completely changes that curve, and these patients do not exactly the same as the general population, but pretty close.
A lot of the research says the first thing you need to do is get multiple opinions, consult multiple doctors. And when I would talk to friends in medicine and my mom's friends in medicine, it kept coming back, you're at MUSC, you're at great hands. The next question was, who's going to do the operation? And when I said Ikonomidis, they said, you don't need to look anywhere else. So I was very confident going into the operation.
The operation itself will, if it's just a valve replacement, aortic valve replacement with no other cardiac procedures, that operation usually will take place in about a 3-hour time span. The patient will spend 1 or 2 days in the intensive care unit and then another 2 to 5 days on the ward, depending on how they bounce back. So the average hospital stay, I would say, is somewhere around 4 or 5 days.
The day before the operation, you check in pretty early, and there's another very extensive physical and more checks. So I felt very confident going into the operation that they'd seen everything they needed to see.
The day of the surgery, everyone was wonderful. They dealt with our nerves well. They were very kind, very accommodating, answered all of our questions. It was a great experience.
The operation itself under Dr. Ikonomidis went very well, and then extending to the nurses and all the doctors that worked with me post-operative went very well. I spent 6 days in the hospital. Coming home was difficult. Getting up out of a chair, sitting down in the chair, sleeping was uncomfortable. But I would say within a week or 2 weeks, I was able to sit down and stand up on my own. Every day my walks got longer. I'd set goals in the neighborhood. I'm going to walk to this neighbor's house this day, and tomorrow I'm going to go 1 mailbox farther, and it just seemed to progress very rapidly. And I would say within a month, I was feeling significantly better, and within 2 months, I was pretty much back to normal.
Ready? 1, 2, 3.
My biggest concern was not being able to lift things. You know, having triplets, I'm very physical with them, and we like to play and swing around and lift them and hold them, and I was really worried I wasn't going to be able to do that for at least a few months. And that came back very quickly, and aerobically it's like night and day. I used to be limited aerobically by my heart. My heart would become elevated very easily, and now I tire when my legs are tired. I've never felt this way before, so it's completely new.